everybody, and welcome to another edition of On the Clock with Personal Living Alert. I'm David, I'm with Personal Living Alert, and today we're talking with Pat Waldron. Pat is the owner of Active Healthcare Solutions. Active Healthcare is a care management company based in Palm Beach County, but they work throughout Florida and they have clients everywhere. And many of you probably remember Pat because she was on our show about 6 months ago. And when the pandemic was just starting to get going and everybody was in lockdown and panicking and things like that, rightfully so. And Pat gave us some great information. But we're going to touch base with her today and talk about what's going on now and how life is. But before we do that, just want to say good morning, Pat. How are you today?
Good morning, David. I am well. Thank you for asking. And I so appreciate this opportunity to meet with you this morning.
Listen, it's my pleasure, my friend. There you go. So, Pat, things are changing a little bit. Restrictions are being lifted. People can go into ALFs and things like that. How are you seeing those lifting of restrictions impacting your business today?
Well, very honestly, David, there's kind of mixed emotions. As you and the general public is aware, there are absolutely two sides to the coin, and there doesn't seem to be any middle road on what is the best approach. Looking at the COVID numbers in Palm Beach County today and the spiking after our Labor Day weekend and kids going back to college and school is a little concerning. So I think that we have to sit on the side of caution, if you will, and do what is best for our clients and ourselves. Because if we are not able to take care of our clients, they are going to be in a bigger quandary than they have been for the past 6 months.
I agree. Are you noticing you're getting better access or more access to the clients who rightfully so, locked themselves in?
It all depends on the family, David. And if the family believes that we are out socializing without being extremely cautious with PPE and masks and hand washing and sanitizing, they are reluctant for us to start a new case. However, our long-term clients, we continue to see with all of the PPE precautions in place. And I actually had 2 COVID positive patients that are COVID negative now for 2 to 3 months. And I visited those patients as often as needed to make sure that they were doing well and following the medical regime. And I am now COVID free for the 5th testing result in 5 months.
So you've tested, you get yourself tested almost once a month?
I try to do it every 2 to 3 weeks.
Yeah. I've gotten, Fabiana and I have both been tested twice, and thank goodness have both come back negative. And again, it's the same reason as you. We have clients, we need to make sure that we're healthy, because if we're not healthy, we can't help them, and we don't want to infect them. So
true, David.
Yeah. So I understand that. So tell me, what does Active Healthcare Solutions do? What is a care manager?
A care manager is like a local daughter. When a family is not present locally and they live afar, New York, Chicago, New Jersey, Europe, and they have aging parents either in their private homes or in a facility, they feel that they have to have somebody overseeing what is going on so their parents are getting whatever they need. So oftentimes when we get those calls from the faraway family, there is quite a history involved with the children what they've done, what they can't do now because of COVID, number one. Number two, many of these adults have children, family, businesses themselves, and they cannot pull away to come to Florida frequently to oversee their parents. And they find that the telephone calls sometimes are not exactly what they are portrayed to be by their parents. Parents don't want to be a burden on the kids, so they always say everything is great. And of course, as you know, David, everything is not always great.
Yeah, I could attest to that on a personal issue. I mean, I'm fortunate that both my parents are alive, but and I talk to them on a regular basis. But every now and then, I'll call and my dad will be whispering, and I'm like, "Dad, why are you whispering? I don't understand." He goes, "Well, I'm in the doctor's office, or I'm in this, or I'm in." Yeah, all right. And that's how you find out. I mean,
That's true.
kind of catch them in a place where you don't want them to be, the doctor's office, the hospital, or something like that. That's the only way they give you information.
And your next question is, well, what's going on that you're at the doctor's office?
Exactly.
And oftentimes you're not aware.
Yeah, yeah, I think you're right. They don't want to be that burden, even though, we have shoulders, we can handle it. We're all getting up there ourselves, and, we can do it. So what separates active active healthcare from the pack? What makes you guys unique?
Well, number one, not only do we have years of combined service as registered nurses, and I believe that care management not only requires the social aspect, the benefits aspect, but it also means that you have to have some understanding of the medical regime that the person is on, understanding the medications that they may be taking for behaviors or illnesses. So one of the big criteria is that we work strictly with nurses as the care manager. And if we need the social worker, we have a contract with one that we work with that will do the social worker piece.
It's amazing to me, and it's probably amazing to a lot of other people who aren't accustomed to the level of knowledge that a care manager has. I'll sit down and I'll talk to a care manager, and they just rattle off the drugs and the interactions with the drugs like they are a doctor. I mean, that level of knowledge is unbelievable.
Well, I'm happy to hear that, number one, because you have to stay attuned. The medicines are changing all of the time. And the geriatric clientele indeed have special needs, Michael, when it comes to the prescription medications. They do not metabolize them in the same fashion that you would metabolize them, or even a younger person. Their systems have slowed down. The medicines can stockpile and create lethargy, which is going to create falls and oftentimes spending more time in the bed.
Yeah, and I know that spending time in the bed or spending time on the ground is not a healthy way to spend your time.
Absolutely not, David. It's as active as we can keep people is extremely important. Two clients come to mind. One of them is 93-year-old Holocaust survivor who is an absolutely wonderful, wonderful human being. And this particular client was a COVID positive person. She didn't leave home, family in Chicago and in Fort Lauderdale area, but everyone stayed in tune to her needs. And this woman stayed relatively healthy during this time, checked every day that it was necessary to check her. And she has come through it clear as a bell.
That's beautiful.
A second client, younger, had no symptoms and wound up getting admitted to the hospital and then back to an ALF. And she has done well. However, with the restrictions that Florida has placed on going into assisted livings, it became necessary for us as a care management team to get clarification from the Agency for Healthcare Administration on were we essential employees or were we not? And indeed, they came down and said we were essential employees. So as long as we met the criteria of the building, CDC, the state, and also what we have put out as policy for our staff that they must follow, we were allowed to make access to our clients. On the flip side of that, we wanted to be extremely careful ourselves, David, that we did not go into environments that had high incidence of COVID and wind up coming out and having it. So that's why, as a team, we test every 2 weeks.
Well, yeah, like we talked about before, if you're not healthy, you can't take care of anybody else and you run the risk. Um, as a care manager, do you accompany clients to doctors so you understand what is actually going on and you can report back to family members? Is that one of the kind of tasks or jobs that you guys do?
One of the biggest issues is communication. And you yourself alluded to it with your father not kind of openly sharing things. So many years ago, when I was getting involved in care management, we had a client that had called his daughter and said that he was going to the hospital the next day to have heart surgery. And the daughter, of course, was trying to make plane reservations and everything to come to Florida. And what the father was actually having was a stress test.
Ah,
So he was not having cardiac surgery. Everybody could kind of settle down for a moment. But the communication piece is imperative that the families know. We have some families that ask us to communicate with them either by text, phone, or email when we make a visit, especially if there is any changes. We oftentimes will just send an email to them and say they are status quo, we've got a doctor's appointment, we will see them next week. But absolutely, we take them to doctors. We examine their documents, power of attorney, healthcare surrogate, HIPAA, to make sure that they have everything up to date, especially in the state of Florida, David. The rules for power of attorney and those things legally changed in 2011. So we want to make sure that our clients have all of their documents looked at. If they do not have an attorney, we will make a suggestion of 3 or 4 people that we have worked with very successfully for other clients, and then let the families or the client themselves make the decision. Doctors, specialists, going to the hospital to communicate with the treating people. We do all of that to make sure that they understand our client, their patient, as best they can to help them move forward instead of backward.
yeah, it really is very nice. Now, I know from a personal perspective, I'm jonesing to go outside, and Fabian and I have started to go outside, right? I am sure your clients are getting the same antsy and anxious and want to go back to living. How do you help them resume a life if they're kind of active and they're not, they're living at home? Do you take them out? How does that go down? I mean, it's got to be normal.
Well, 2 clients in particular absolutely are chomping at the bit to go shopping, to do this, that, the other thing. And what I have done with them, I have gone to 2 or 3 nice restaurants, not the highest scale, certainly upper than middle.
Mhm.
and at restaurants and looked at them and looked at how they are handling their COVID. And I actually have taken out one client twice, and we're going out tomorrow night again. We make an early reservation, and there's very few people there. Everything is social distance, and everyone is living up to the protocols. So that has been a blessing to have some places open up and take this whole COVID-19 seriously. The other client, I've only taken her out once. But what I have done, David, is those two clients live in assisted living buildings, either on the IL side or the assisted living side. And I do not want them going to the dining room at this time. I
Oh,
want them to stay and eat in their apartments until we have more favorable numbers, especially in the senior community.
yeah, I can understand that. I really like your idea of eating off hours. That is just genius. I mean, and that's just not just for your clients, that's anybody who wants to go out. I like that idea a lot.
100%. And anytime we can, if it's cool enough and the sun's not hitting you in the face, we will sit outside.
Yeah. I like that idea a lot. I mean, even for like me, if you want to go out to lunch, do it at 2:30 when nobody's there or fewer
For
people.
sure. Yeah, absolutely.
Ready? So are you noticing that the ALFs, the assisted living facilities, are still impacted by COVID as far as having COVID positive people, or are they getting a good handle on it, or is it just too fluid?
I believe it's better. I do not think that it is completely resolved. I have heard this week that they are probably going to slow down on mandating that the aides and personnel that work inside the buildings will not have to be checked as often for COVID-19. Many of the buildings have started to do the testing themselves. So having said that, I was in a building yesterday for the first time myself in 6 months. And I was a little surprised. I was completely prepared with my document stating that I was COVID negative, waiting for the questionnaire and what have you. And I had my badge on. And when I went in the building, the young man that was the gatekeeper said, "Oh, no problem. I trust you. I don't need to see anything." So
Really?
that was a little surprising to me.
Mhm.
Other buildings, they are so diligent about what they are doing. I will say the young man took my temperature and made me sign that I was going to visit a particular patient and that I had not been exposed or was sick, kind of thing, but didn't care that I had a negative COVID test, which surprised me again.
I actually was in a building yesterday also, and I found it interesting. Yes, I didn't bring my COVID. I didn't think to bring the fact that I was negative, but they did take my temperature. I wore my mask. But, you know, this COVID thing is very fluid in the fact that for a while they were COVID free. Then they got a COVID, then somebody contracted it. And I think Thursday is their 14 days of being COVID free again. So they're going to start allowing visitors back in. So it just, this disease is just, it just screws with your brain because you're good one day, then your facility shuts down the next day. People are in dining rooms, not in dining rooms. It really has to take a mental toll on the residents.
Oh, there's no question about it. The rise in depression in the senior community is absolutely terrible. David, they just don't know what to do with themselves. And it can be as simple as taking a walk outside the building to get some fresh air or going to Publix with their mask on. But there is such fear by the families and how to do it appropriately that they'd rather not do it at all and take the chance that they may get sick. My little 93-year-old that turned COVID positive and we kept her in her apartment, she was not only depressed that she had COVID, she was angry that she had it. And she wanted to know how she got it. She was very, very upset by it. However, the quarantine was fairly easy for her because she could reflect back on her days in a concentration camp and what that meant compared to what COVID meant. And again, she is a wonderful, wonderful human being and lady. I love her.
Yeah, there you go. This is a walk in the park compared to what she's gone.
Yep, no question.
So let me ask you this, Pat. How long has Active, been around?
Actually, approximately 6 years ago, I had opened up a division myself, and I did a little here and there. And then in 2014, my business partner and friend of 35 years and I decided that instead of traveling nationally, because we were both national executives for home care companies and assisted living companies, we decided that we would take our certification and move forward in the care management business. And it has been such a wonderful eye-opener for us, David, to be able to impact not only the client themselves that could be 70, 80, 90, 100 years old, it has also impacted their families in a positive way, where they know that they can pick up that phone and say, I'm worried about Dad, can you please go over? And we will get up anytime, day or night, and go over and check them to make sure that they are okay. So the depression needs to stop. So we need to get a handle on COVID as quickly as we can through vaccines, appropriate PPE to everyone, and the complete understanding that this will not go away unless we as a society take it seriously. Otherwise, we're going to be facing much bigger problems in the future.
That I couldn't agree more. That is well said. Pat, if somebody wanted to get in touch with you and needs a care manager or just has questions, how can they reach you?
They can reach me. They can go to our website, number one, which is www.activehealthcaresolutionsllc.com. We also have a Facebook page. I do want to tell you that in Google Business, we have many, many reviews. There is not a one of them that is under 5 stars, and I'm extremely proud of that, where families are saying what we've done. Or they can reach out to me on my cell phone. Day, evening, I usually retire about 9:30, and I'm up 7:30, 8 o'clock. And that number is 561-302-6496. And I will be happy to spend time. And even if we are not the right care management firm, or care management is not in the plan for their loved ones, we will try to help them by giving them a lifeline so they can reach out to resources to help them with their parents or siblings, whatever the case may be.
That's beautiful. I just want to say thank you again for being on. It's my honor, my pleasure. And I just want to say thank you for being a participant on the clock.
I want to thank you again. And as a final reminder, please everyone be safe, wash your hands, and wear your masks. And I will look forward to us all being in a healthier situation. Thank you, David.
Well said, my friend. I will talk to you soon.
All right. Bye-bye.